Hi there, welcome to Studio B. If you're new here, my name's Natasha. Through my professional experience and my own cancer survivor story, I'm here to guide you through every step to becoming the best person I know you can be. So if this is something you may be interested in, make sure you hit subscribe and hit the bell so that you get notified every time I post a new video. This is the progression video from the previous video I uploaded that was recommended for patients up to 2 weeks after particular types of surgery. This exercise routine is recommended for patients approximately 2 to 6 weeks after surgery. However, depending on the type of surgery you have, some of these exercises might be achieved early on in your recovery. Please consult your medical professional before starting any of these exercises. If you had a drain-in, it most likely will be out by now. However, if it isn't, please adhere to your surgeon's protocol. Some of the exercises in this video are the same as those in the first video, however it is encouraged to further increase your range of movement. You should aim to reach full movement of the shoulder joint about 4 to 6 weeks after the removal of your drains or after surgery if you had no drains. It is recommended to do small amounts of exercise throughout your day rather than one big session of exercise. Repeat every exercise 10 times and at regular intervals at least twice a day. None of these exercises should affect or pull on your stitches. However, if they happen to do so, please seek medical assistance. All exercises can be done from either a standing or seated position. Alright, let's get started here. We begin with diaphragm breathing. Position yourself upright. Imagine your spine is a row of building blocks stacked one on top of the other. Relax your shoulders and open up through your chest. Breathe in through your nose slowly to fill the bottom of your lungs and slowly breathe out through your mouth. You may choose to place your hands at the bottom of your ribs as I have shown in the video, where you should be able to feel your lungs expand as you take a deep breath in and collapse on the breath out. The next exercise is shoulder shrugs. Simply shrug both of your shoulders as comfortably as you can up towards your ears and then slowly down. Try and be aware of your positioning so that those building blocks stay stacked, your feet are hip-width distance apart, and your knees are soft if standing. Imagine you have a double chin to avoid poking your chin out. Now to perform shoulder rolls. Roll your shoulders up and forwards in a circle 10 times. You may notice that closer towards the end of the 10 reps, you may find that you have more movement and it is a little easier to move than when you first started. Now repeat this exercise in reverse by rolling your shoulders up and backwards in a circle. Hand slides up your back. Now place the back of your hand on your bottom and slowly slide your hand up towards your head and then slide it back down towards your bottom. Try to relax your shoulders as you do so. Forward wall climb. Stand facing a wall, slowly walk or slide your fingers up the wall and then slowly back down. To make sure you are doing your exercises correctly, you can also do the exercises in front of a mirror. A little trick that my own specialist physiotherapist recommended, which made a world of difference, was to walk up the wall with your pinky finger. This will help to use the correct muscles when moving our shoulder and discourage any unwanted compensatory behaviours. Sideways wall climb. Stand with your operated arm side onto the wall. Slowly walk or slide your fingers up the wall, then slowly back down. You may have to take a step or two closer towards the wall to crawl your hands further up the wall. Remembering to check in every now and then on your posture, to keep those building blocks stacked, your feet hip-width distance apart and your shoulders relaxed. It is important to move through these exercises slowly and not to force any movement or push through any pain. Forward arm lifts with your hands together. Stand with your hands clasped together, shoulders away from your ears and thumbs pointing towards the ceiling. Lift your arms up to a height where you feel comfortable to do so, and then slowly lower them. This exercise can be done either from standing or lying down. Chest opening with elbows pointing out. Place both hands behind your head in line with your ears. Slowly open up the chest and point the elbows out. Then slowly move the elbows towards each other. It is important to do this movement at your own pace and only move within the range that feels comfortable for you. Shoulder blade squeeze. Slowly squeeze your shoulder blades back and down. You may feel a slight opening through your chest as you do so. Hold for 2 to 3 seconds and release. Hand slides behind the head. Place your hand behind your head and slowly slide your hand down your head towards your shoulders, then back up towards your head. This exercise might not be possible until exercises 5, 6 and 7 are a little easier, so that you have more movement of the shoulder joint. Now to perform shoulder blade movements. Raise both arms to about 90 degrees of shoulder height and place them on a wall in front of you. Take a few breaths here to start with, encouraging the air to fill the bottom of your ribs. Checking in on your posture, those building blocks should be stacked, your feet hip-width distance apart and your shoulders away from your ears. Slowly squeeze your shoulder blades together, back and down, like you did with the shoulder blade squeeze exercise, so that you may feel a slight opening through the front of your chest as you do so. Then slowly glide your shoulder blades away from the midline, forwards, as if you were seated and wrapping yourself into a ball or hugging your knees. Start with a smaller movement each way. As the exercise becomes more comfortable, you can increase your range of movement. Child's pose stretch. Bringing your toes together and sliding your knees apart, send your tailbone back towards your heels and crawl or walk your hands in front of you. Remember not to push through any pain. Take a few breaths here. Every time you exhale, try and sink a little deeper. Crawl or walk your hands to the left. You can place your right hand on top of your left hand and look underneath your left armpit to deepen the stretch down the right side of your body. Take a few breaths here. Then crawl or walk your hands to the right. You can place your left hand on top of your right hand and look underneath your right armpit to deepen the stretch down the left side of your body. Hold this pose for a few breaths. If you can't get down on your knees, you can do the same exercise sitting in a chair, stretching forwards on a table. You will find a list of the exercises demonstrated in this video up on your screen. It is important to only do the number of exercises that feels right for you at any given time. You may find that some days are better than others, and that is completely normal. You should gradually see an improvement over time with your strength and flexibility. Once you can do these exercises, try the next progression of exercises. You will find this video on my YouTube channel at Studio B Health and Wellness. I hope you liked this video. If you did, make sure to let me know by giving this video a thumbs up and hitting subscribe. I'll see you guys soon with another video. I hope you have a good day. Please remember to be kind to yourself. Bye for now.